Everyone is waiting for this lecture.
Okay, well, as I told you the other day, started with one idea and ventured into other ideas, and it grew a little bit out of control. But I thought it will be good to add more examples and to actually have a bit of a deeper discussion around what we're seeing and um, just address some common myths that we have in our industry about treating women who suffer with hormonal imbalances. Right, shall we wait a little bit more, or shall I go ahead and start sharing the presentation, do you think?
We can wait a little more, and during this time,
Okay.
I can introduce you to the ones
Right.
who, just in case, doesn't know you.
Mhm.
So, I'm really truly happy to see so many people here joining us already. And tonight we have a speaker who represents the kind of depth, experience, clinical thinking that our industry truly needs. Geri Panayotova is an electrologist and educator from the United Kingdom with over 20 years of hands-on clinical experience. But what truly sets her apart is not just the years, but the way she thinks, analyzes, and approaches complex cases. She is a former board director of the British Institute and Association of Electrolysis, and one of the most respected professional organizations in the field, where she contributed to shaping standards and professional education. Throughout her career, Geri has worked with a wide range of challenging and often misunderstood cases, especially involving hormonal factors, laser-inducted hair growth, and complex facial treatments. So she knows for her ability to take situations where there is no obvious answer and bring structure, clarity, and clinical reasoning into the decision-making process. So that is exactly why her work is so valuable. Um, so today, Geri will introduce her lecture. I'll give you the stage and looking forward for it so much.
Thank you. Well, that was a great introduction. I made a slide, but you did it so much better than me.
You can
Okay, I'm
still
just
have
going
it.
to. No, that's all right. I'm just going to share. Um, let's see that I did not forget how to do that. Here we go. Lovely. So I will lower these screens. Now, one thing that I was going to say, this is a very visual presentation. So if listeners can get themselves on a laptop so that they have a bigger screen, do so. If you can use if you're on a mobile phone and if you can use your white screen, that would be better. I will go and zoom in on some pictures just so that people on mobile can also look and see the pictures, because there's going to be a lot of pictures and me talking over that. Okay, I'm just going to skip that. Lovely. Okay. So as we said today, we're going to be talking about treating PCOS sisters. And this is a name that I borrowed from a Facebook group, slightly different spelling, but it sounded to me like a powerful movement of women coming together to help each other out. And this resonated with what we do. Our sector is dominated by women, and a lot of our work is also helping other women going through hormonal changes and suffering with unwanted hair. And especially because hair, it's still seen as this such a deep, shameful thing that people don't like to talk about much to other people around. Although we're seeing really difference this trend. Thankfully, Gen Zs and Gen Alpha are quite happy to go to social media and talk about everything, and struggling with hair problems, unwanted hair, and going through different hair removal treatments, and their success or unsuccessful treatments. Sharing that information with everyone has been amazing. A lot to learn, definitely, on social media. So this is something I saw shared on our groups as a good example of electrolysis. Is something that also triggered me to talk more about it, because at the same time that we're treating so many women with hormonal problems, we're also hearing so many myths and misinformation about what a treatment of electrolysis can do to the for the women suffering with electrolysis. So kind of I want to put a focus on, do hormones really matter for electrolysis when we're looking at this presentation. So this is the actual video that I saw shared on one of our groups. A lovely lady who's an American creator called Your Hairy Godmother. She shared her whole journey on YouTube. A lot of interesting pictures, and this is kind of the essence of it that she shared. About 3 years of progress, about 155 hours of electrolysis to get her from the picture on the left to the picture on the right. And looking at these pictures, I started getting a little bit upset and sad. Other things that made me upset watching this video were skin reaction. It's really unnecessary. Her skin's recovered beautifully, and she's worked so hard at helping her skin recover. She's really outstanding client that has done everything to help herself, but really this amount of reaction is absolutely unnecessary. And if you go and watch the videos, you will very quickly understand why she's had so much reaction. But also the other thing that really upset me was, if you have a look at the top picture on the top, which is at 52 hours, and see the amount of hair she's got under her neck, and then you see another 50 odd hours later, that hasn't really changed much. You start thinking, what did they do in those 50 hours, right? So let's have a look at what PCOA is quickly and see what a journey should look like. So just the PCOS facts quickly. PCOS is a complex endocrine and metabolic disorder, and we don't know everything about it yet. We don't know why people are getting it. We know that there is some that it can be inherited from moms to daughters. It does run in families, but we don't understand why it starts exactly. So it's 1 in 10 women that suffers in PCOS, and the percentages vary from country to country, but it is very common. Hirsutism, or the presence of more hair than what we expect in areas that we don't normally expect from a female face, is one of the diagnostic criteria as a predictive criteria of hyperandrogenism. So in the UK, for PCOS diagnosis, doctors need to confirm hyperandrogenism, or the circulation of too much androgens in the client's body. And that can be done by blood tests or by the presence of hirsutism. For comparison, or just as an extra info, acne alone is not considered sufficient predictive for hyperandrogenism. The two things they're trying to assess to confirm diagnosis of PCOS is ovulatory dysfunction and ovarian cysts. oops, this is not what I was trying to do. Right. Hirsutism, as we know, is resistant to medical therapy. Different medications are used to try and help women suffering with it, or to try to regulate their hormones. For example, the most common one in the UK is Dianet. A milder version is Yasmin. Those are types of contraceptive pills that help normalize people's periods and prevent the formation of cysts and then the release of massive amounts of hormones in the body. And it works well for some people. It controls their hormone levels, but also it can tame down the aggressive growth of hair. I have seen in some clients it miniaturizing hair, not massively, but doing something to slow it down, to make it a little bit smaller, and helping with acne, definitely. So that would mean that it's reducing the activity of the sebaceous glands, and people being better able to control their weight. And talking about weight, there's also metformin that it's very, very common nowadays to be prescribed to women with PCOS, and we're going to look at the dynamics of that a little bit later to understand why they're doing that. And it helps some people. It would not stop hair growing. So we still actually, or women with PCOS still need help getting rid of the hair that has grown by the time that they get medical help. By the way, in the UK, or actually around the world, it takes at least 2 years to get diagnosed, from first going to GP to complain with symptoms of PCOS to actually get diagnosed. So in that time, the hormones that are not regulated are causing changes in the body that are staying for good. And by the time clients get to diagnosis, they're already emotionally exhausted and medically frustrated because they have been through a few doctors that have gaslit them that they just need to lose weight, that they just need to start exercising more, that they just need to cut carbs, and that sort of thing. And they're being dismissed consistently while they're trying hard to stay healthy. Okay. But what is the actual real face of PCOS? Not that pretty face that we see on this slide. This is the real face of PCOS. And I read a very interesting study. It was actually a systemic review of clinical studies on PCOS, which was called The Invisible Struggle, the Psychosocial Aspects of Polycystic Ovary Syndrome. And something interesting they said in that review was that the condition is stigmatizing and affects a woman's identity, mental health, and quality of life. The prevalence of anxiety and depressive disorders among women with PCOS ranges from 28 to 39% for anxiety and 11 to 25% for depression. So hair is not purely cosmetic problem. It profoundly affects life of women. I'm sure that you have worked with women who've left their jobs because their hair, unwanted hair on their face has become unmanageable. They don't have the confidence to apply for promotions or for jobs. Many don't have any social life because it's impossible to manage the amount of facial hair they have. And many have just become hermits, isolated at home without income, which makes it very difficult to then look for privately for help. And unfortunately, electrolysis is still not covered on in healthcare services through the usual, like in the UK's the NHS. So by the time women come to us, they're very, very depressed, frustrated, and very little patience, and they're very difficult sometimes to work with. We need to have more patience to be able to take them on this journey. A couple of other things that I just wanted to address quickly. Body image distress and reduced self-esteem. Again, from this study, the physical symptoms of PCOS, such as acne, hirsutism, and weight gain, lead to low self-esteem, negative body image, and feeling of being abnormal or not woman enough. Frustration and disempowerment in women. A common feeling is frustration with the lack of immediate answers, the trial and error nature of treatments, and feeling blamed by practitioners for symptoms like weight gain. So electrolysis is not just a cosmetic procedure, it is a medically relevant, psychologically transformative, and permanent solution for hormonally driven hirsutism in clients with PCOS. Let's get to the pictures now. So this lady I worked with between 2018 and 2021. She has PCOS. It is not managed in any way. She is clinically obese. She contacted me a year before her wedding. She had started preparing for her wedding earlier by actually going for laser treatment. She had upper lip, chin, and sideburn hair that she went to treat with the laser and ended up with full beard from the top of the cheeks to the midline of the neck. I'm just going to zoom in on the pictures so that people can see the density of this hair. And you can, okay, maybe not as much. Okay. You can compare also with that picture that we saw earlier of the lady. This hairline starts much higher on the cheek, and the density is considerably higher on this client. This is what it looks like underneath her chin. And you can see that laser's actually done a good job on her upper lip and tip of her chin, but not on the rest of her face. Okay. So I treated this client on a machine called Instantron Elite Spectrum. It's a machine offering both thermolysis and blend, but also offering flash thermolysis or quick thermolysis. And I use the setting that is 1/10 of a second on 100% of the energy this machine is capable of, using 2 to 3 pulses with displacement technique. And I used a probe that's called insulated bulbous probe, the Loria probes, size 6. Sadly, we don't get these anymore. So I'm still trying to bring back. Let me see if there's any other way of zooming out on my screen. All right, maybe. Okay, that's a bit too much. Let's go back to it. Here we go. All right, and so this is the reduction she's experienced after 1 year of treatment. In this 1 year of treatment, we've done 47 hours of treatment, and we've had roughly monthly clearances. So just to quickly go over it. At the beginning, so she could tolerate just 2 hours at a time. And what we did was we would work on a quarter of her face at a time. So it will take 4 sessions to clear her whole face. Now I'm just going to zoom in. Oops. Okay. All right. Let's see if my laptop will do what I want it to do. Here we go. You can see that there's quite a massive reduction, but this is just a few weeks of growth and about 4 or 5 days of not shaving. So she's only shaving between treatments. She's in client-facing job where she has to speak to clients on a daily basis. Okay. And we're going to move on to the next one. So here it's actually not 1 year, it's nearly a year and a half of no treatment, and it's taken me 90 minutes of clearance. The lady did get married and then did go away to live somewhere else. And she came back a year and a half later after the pandemic to have a touch-up treatment, and I haven't seen her since. But this is all that had grown in a year and a half. So her total treatment time over this period is 60 hours. That's quite different to the 160 hours the other lady on YouTube had. And I've actually put the treatment schedule here. And if you follow through the dates, you will see that in the beginning, we've had here and there the odd month when she's been away and she's not had treatment, but she's had regular treatment for about a year. She started in May, in the end of May, and then by next year, May, June, when her wedding was, is when we kind of wrapped up with her regular treatment. Over the next 6 months, she had odd treatments here and there, as in when she's around and she can, but she only had, what is this, 3, 4 treatments. And then she was away for a year and a half. So as you can see, if you leave a long gap between treatments, the head doesn't grow back, like, because we've killed it. And most of the work is done in just 1 year. This is another lady. This is Fitzpatrick skin type 6. This lady is also diagnosed with PCOS. She has not had laser. She is very, very overweight, and she's on no treatment for her hormones whatsoever. Because she was traveling from quite far, it was difficult for her to get treatments in. And she came in quite irregularly and left a few months in between treatments here and there. Now, I treated her on the same machine, very similar approach, flash thermolysis with displacement, but by this point I didn't have access to IBP probes anymore, and she was treated with gold probes instead. So this is how we started. Maybe I'll just try and zoom in, but I think on this case it's quite clear. You can see all the post-inflammatory hyperpigmentation that she's experiencing purely from the hair growing. She's not started treatment on these slides yet. This is 1 year of treatment on the picture on the top left, and then the second picture is 2 years of treatment. Now, by 1 year of treatment, we were down to 90 minutes per clearance, and we'd accumulated 14 hours of treatment. And by the second picture on the right, we've accumulated 22 hours of treatment. Clearance takes 45 minutes, but she was actually having tidy ups on her eyebrows as well. So in the end, it was more like 15 minutes to pick up most of her hair on the original area. Now, this is what her schedule looked like. In the beginning, she got her first clearance over a couple of months, which totaled about 4 hours. And then she left it for 3 months and came back and again she had 3 hours in one go to clear the whole face. And when she returned just 6 weeks later, we were able to clear it in half the time, just 1.5 hours. And then, as you can see, she would leave it 2-3 months and she'll come in whenever she can. And sometimes she'd be able to come in more frequently, but that will result in shorter sessions and so on. But it eventually does dwindle down. So if she started in April 22, by April 24, we've gone from 4 hours to clear it to 1.5 hours to clear the whole area that we were we were addressing, and she has totaled over this whole time 22 hours of treatment. Of course, this area is much smaller than the other lady, so I'm not comparing that at all. I'm just trying to point that whether people will be coming weekly, bi-weekly, monthly, and so on, they shouldn't really actually need to be coming weekly after a while, but depending on the strategy, but it doesn't matter. Each treatment is a step progressing towards the end. And this third example is a Caucasian lady that had a very different strategy. She was on a budget. She came in religiously every month for 2 hours because that was what she could afford. Now she's very blonde, and a lot of the hair is very difficult to see, but I've got some pictures that I've just added here to show you the pure density of hair growth that she had on her face. So she's also suffering with PCOS. She's not overweight. She's not on any hormonal treatment. She doesn't do anything special about it. And by the point I started working with her, I was using Apellis Excel, and I used Synchro for most of her treatments with a gold Sterex probe size 5. I am just going to zoom this in a little bit to show what was possible. She was just able to grow the hair for a couple of days at a time, and that's what you can see. So this is a year of treatment. We started with because she's on a budget and we couldn't clear the whole face, we started with the most important areas, and obviously that's the front bit, like cheeks, chin, jawline. And once we had less hair there, we started moving down her neck. So far, she's in a year she'd accumulated 24 hours. Now the second picture on the right, I took just because I could show that there is a follicle there with three hairs. You can just about see 2 on there, but also you can see all these, the doubles and triples, and really dense hair growth. Now, after a couple of years of treatment, we've gone down to an hour every couple of months, and we've accumulated 40 hours of treatment so far. And you can see where we're starting to go into the finer hair, just below her earlobe. I'm just going to zoom this in. You can see how much fine hair there is. It's just tons. It's really dense hair this lady had. And you can see also the beautiful skin. Once the initial treatment has completed and the skin has recovered fully, beautiful clear skin we've left. Can't seem to get this right. Okay, this is the picture that I took just to show the density again. And you can see that the blonde accelerated vellus hair on her neck, which she doesn't really care much about. The last few hours, we really worked on blending this sort of hair into the sides of her neck so that it's not very visible. This is the point at which she stopped shaving. Almost, maybe shaves one every few weeks, but that allowed for us to actually then see this fine hair, which grows much slower than coarse hair, and so that's why it wasn't visible before. And after 3 years of treatment, totaling 45 hours, this is actually before her last treatment. So there was this, the pictures are from 44 hours of treatment. We've done another hour to blend her neck hair more and pick any odd thick hairs. But as you can see, even though we've left it so it's been 2 months between the last 2 treatments, there was only the odd one hair on her face. And you can see she's stuck to monthly treatment up until very recently, last year. So when did we start skipping? Okay, so yeah, we went to 6 weeks at about a year and a half, a year and 7 months. And yeah, I haven't seen her for a few months now, so I haven't seen her for 6 months. She must be happy with her reduction. So again, you know, even though she's with PCOS and it's not regulated in any way, she's seen great success with electrolysis. So let's wrap up what myths we have disproved today. Myth 1, if hormones are the problem, electrolysis won't work. False. It permanently destroys treated follicles the first time you treat it, when you treat it properly. Myth 2, laser is better for PCOS. It's not for everyone. It can work for some people. I have had successful stories with laser. However, when there's mixture of hairs and textures and fine hair around, it also can induce hair growth, like paradoxical hypertrichosis, so it's quite risky. Myth 3, it's hopeless without medication. Not at all, and I'll go more into that later. But many women achieve life-changing results without hormonal suppression. And myth 4, it won't work if clients don't come in weekly. Again, not at all. Every session kills the hairs that are treated, if they're treated properly, if they're done correctly. So every session is a step forward towards completion. So do hormones matter then? Well, yes, they do, but not in the way that some people will try to convince us they do. Let's recap a bit of the science so that we can relate it to how it is actually relevant to what we do. So the dermal papilla is a ball of hair follicle dermal sheet cells swimming in extracellular matrix engulfed by the hair bulb. During anagen stage, the extracellular matrix swells up and the loop of capillaries is rebuilt, but the number of dermal papilla cells is consistent through the hair cycle stages. The dermal papilla is a command center that signals to keratinocytes and other cells in the follicle what to do, like when to start moving, when to start dividing, and what type of cells to differentiate into. The dermal papilla cells contain various receptors inside the cell membrane. So that's not on the outside, but it's inside the cell membrane. And scientists have identified that at least one type of these receptors is androgen receptor. When androgens, the hormones, reach inside the dermal papilla cells and they bind to these receptors, and cause an alteration in gene expression, causing insulin-like growth factor expression in the dermal papilla. IGF-1 is a growth factor primarily secreted by dermal papilla cells in hair-bearing skin that stimulates hair follicle proliferation and vascularization and promotes the transition to anagen growth phase of the hair follicle by activating key pathways. I'm not going to read all the letters. IGF-1 also inhibits apoptosis and prolongs the follicular growth phase, so it makes anagen longer. It also boosts it's the vascular EGF growth factor expression, which supports microcirculation and nutrient delivery to a hair follicle, so it helps hairs to get nice and juicy. Interestingly, though, androgens have varying degree of effect on follicles in different body areas due to the difference in the number of androgen receptors dermal papilla cells have. Like in the chin area, dermal papilla cells have more androgen receptors than higher on the cheeks, for example. And that's why we're seeing the different levels of stimulation. So what does it mean for us? The Ferriman-Gallwey scale of hirsutism, which the Ferriman-Gallwey scale is the picture you see on the right side, that helps doctors to diagnose hirsutism, basically. But also you can use in your consultation to mark at what level of hirsutism this client is when it's starting with you, and it will help you to follow the progress. So this is a great visual aid to show where the follicles with more androgen receptors are. These are the ones that get stimulated first, and we all know where they are. They're the corners of the lip, the corners of the chin, a couple of patches there. There's also the sideburns for some people, and that's where it always starts. And once it starts from there, it then spreads outwards. So these are the first to react, and they react to the lowest levels of increased androgens. The higher the androgen levels they go, the higher a person ranks on the scale, because more follicles from lower sensitivity areas become stimulated. It is important to draw your attention to the fact that the hair follicle stimulation is correlated, or you can see it as a function of the level of hormones, not just the presence of hormones, but the level of hormones in the blood, or the time. So it's not for how long the person has had the hormones increased, but how high the levels increased that we can judge by the level of hirsutism they have. So it is logical to conclude that the hair follicles that are sensitive enough to respond with terminal hair growth to the already increased levels of androgens have already done so. And as long as androgen levels don't increase any further, we're not expecting to see much further terminal hair appearing once we have completed the course of electrolysis treatments over 2 years. Since androgens can only stimulate vellus hair into terminal, but cannot form new follicles, if you clear as much vellus hair, or at least the accelerated vellus hair, in your treatment course, as you can see, in androgen-dependent areas, you will prevent a large part of the future growth in the area. So that's why in your consultation it's extremely important that you understand where your client is in terms of their hormonal imbalance. How long have they had the hair for? For example, if you have a woman coming to you that suffered with PCOS for 15, 20 years, this woman's already developed the full amount of hormonally sensitive follicles. And once you've treated them all and you've waited to see the accelerated vellus hair, and you've treated this, you're not going to see any more growth later on. You're not going to need management for that client. It's a different type of client that I'm going to show you a little bit later on that will need management. But I want to quickly look at what other hormones can also influence hair growth. Apart from androgens, the role of other hormones is also currently being researched. For example, estradiol can significantly alter the hair follicle growth and cycle by binding to estrogen receptors and influencing aromatase activity, which is responsible for converting androgen into estrogen. Progesterone at the level of the hair follicle decreases the conversion of testosterone into the DHT. The DHT, dihydrotestosterone, is the more active form of testosterone that causes baldness. The influence also of prolactin on hair growth has also been intensively investigated at the moment, and prolactin receptors were detected in human scalp hair. Another important one is, of course, insulin, especially since many PCOS sisters suffer with insulin resistance and hyperinsulinemia. There are multiple clinical studies in the last 20 years on the effect of metformin, which is an anti-diabetic medication regulating insulin levels in the body on hirsutism. And this is just one of these studies. I've just got a quick abstract here. The effect of metformin on hirsutism and polycystic ovary syndrome. So this was quite a small sample, just 16 women that they measured, and they used hirsutism. They used the Fairman-Galway score. So this can sometimes be a little bit subjective, but the conclusion is that they demonstrated that metformin treatment in a group of women with PCOS results in a clinically and statistically significant improvement in hair growth compared with placebo. So it is something that can help women who are insulin resistant with specifically with hair growth. If you look at the numbers, it's actually a very small difference, but it is considered statistically significant, so it's big enough to actually matter. Electrolysis is still the best way to tackle the hair for good, if you know what you're doing. In conclusion, I just wanted to show you the case, the type of client who will require lifelong management. And whenever someone with PCOS asks for advice on the Facebook groups, this is the sort of case everyone talks about. Oh, you're going to need management for life. Well, no, it depends on the case. This particular lady will need management for life, because when I first saw her, she was not even 18 yet. I believe she was 17 in 2021. You can see she had some hair develop on her chin and on her sides. We cleared that in 3 or 4 treatments. That's all it took. And I've been seeing her on and off because we have done other areas. So we've cleared her tummy, we've done some nipple work, you know, the usual bits and bobs. And more recently in 2024, she noticed, and you can see how much her sideburn had changed. She hadn't quite noticed it, that it's changed so much. It's only when we looked at the pictures that she realized how much further down her sideburn has grown. But this year, it's actually a lot more hair on her jawline that is growing, and she recently finally got a diagnosis of PCOS just a month ago. Now, because when she came in 2021, there was only a small amount of her hormonally sensitive hair follicles developed, and we treated those. And there was a lot of very, very fine vellus hair, which we didn't touch at the time. As time passed and her hormone imbalance continued stimulating these fine hairs, which is quite normal as well, because there's more growth factors in young people. They continue developing their hair pattern until they're 25 at least. But you can see how this vellus hair has become more obvious. Some of it has become terminal hair, but it's a very gradual process. And because her condition is not managed by hormones in any way, her body's allowing for these hormones to actually stimulate some of that vellus hair. So she didn't start with fully developed hair growth pattern. She started at the very beginning of her hair problems, and that's why she's needing to have touch-ups throughout the years as her body is stimulating more of those follicles that are sensitive to it. So while there's some progress in discovering medications that will hold hirsutism back, like diet and metformin, only electroepilation is capable of solving the hirsutism problem for good. And as you saw from the case studies with high precision treatment, the clients daily struggle with unwanted hair is a thing from the past. After a year of treatment and after 2 years, they've really forgotten, and their confidence is back. Their social and romantic lives are fully restored. There's nothing better than the clients coming in and showing me pictures of their boyfriends and girlfriends, or telling me about their new jobs, that they've got thanks to not having the hair. So that's why I do it 7 days a week most weeks. And the only cases that will require continuous management are the young people or people in the beginning of their hormonal imbalance that haven't developed the full extent of their vellus hair turning into terminal in the androgen sensitive areas, and start with just little bit of hair. Okay, and I think that is all from the presentation, all from me. So Emma, I don't know if there's any questions. I'm trying to figure out how to stop sharing this.
Yes, we have questions. So what are you using to take the pictures, and do you have a setup that keeps it attached, or do you do it by hand?
I'm the worst person to ask for this. I have invested in about, I don't know, 5-10 cameras now, and none of them really works very well. So where I've taken the most pictures is a Chinese phone called Xiaomi, but it was an older version that has AI on it, and all I need to do is put the flash on, point, and take a picture, and it does it for me. So I bought 3 of those phones, and unfortunately now they're almost all broken, and I'm in the pursuit of a new phone. Sadly, the newer models of this same company don't take the same pictures. So it's a struggle for me. I'm very bad at pictures. It was only thanks to this phone that I was able to take so many good pictures. I have a professional camera, but I don't understand the settings. I think phones are amazing at doing this, but perhaps just play with different phones until you find something that works for you. That's my only advice. I'm not a tech person. I just get other people to help me with it, and when I find something, I stick with it.
Okay. You referenced the research on metformin and its effect on hirsutism. How should practitioners interpret these findings when managing client expectations?
You really don't. As you see, without any management, none of these 3 clients, none of them were on any sort of medical management, and we still got the results. If you're clearing the area regularly over a period of 12 months, you will have dealt with most of the hair. For the next 6 to 12 months, you're picking up odd hairs that are coming through. But really, after 2 years with regular treatment, there should be hardly anything left. So the hormones are irrelevant. This is what I was trying to say earlier. If it's someone who has had PCOS for a while, they've already developed the hair from the follicles that are already that are sensitive to this level of hormones. Normally, people have roughly the same levels of hormones once they have an established hormonal imbalance. So their hormones will vary in some sort of a range, yeah? And their body, their skin, the follicles sensitive to those levels will have responded already and developed already. So once you kill them, They shouldn't be having any more hair growth. You can talk about this with your clients, and clients often share that they're going to see the consultant. The consultants recommended this or that. But for me, it doesn't matter. If they decide to go on to diet, let's say, do tell them that they will probably notice the hair getting a little bit slower growing and a little bit finer. But they need to know that the moment they stop the medication, which they will do one day, the hair will come back. So I prefer to try and clear as much as I can so that they don't have to deal with future problems. And on this type of clients, picking just the coarse hair doesn't work. That's not a strategy. You've got to pick everything you can see in order to prevent future hair growth from finer, accelerated those hairs. I hope this makes sense.
Okay, a few more questions. So, how do you do your treatment planning for such cases?
It depends on the client. I have an ideal case scenario that I tell them that, let's say, I always try to achieve first clearance as soon as possible. And then the idea is to keep the skin clear so they don't stress about having to do something with the hair growth. We have busy lives, busy jobs. We need to be presentable. So we schedule treatments however they can get them in their busy life, but also in a way that to keep them hair free so that they're not having to deal with the hair. Of course, if it's not possible, if it's a lot of hair, then they'll be shaving in between. But then people have limitations. People have budget limitations. People have other time limitations, families, children, and so on. As the cases here that I showed you with the lady, Fitzpatrick IV lady, who could only really come in every 2-3 months. So I will schedule them. I will try to schedule enough time to allow me to do a clearance, if possible, in one go. And of course, if possible, at my skill and at my equipment level. But we are going to talk about to clear or not to clear when we meet in Warsaw next month. So here I'm just going to say, in my case, most of the time I'm able to clear, so I will schedule enough time to allow me to clear them. Hopefully they can afford it. And if they can't, I will focus on the areas that are more important for them, and then we'll extend into the areas that are like more hidden later on, when we don't need as much time for the more visible areas. So I work with the client, basically. If they have limitations, I do the best within their limitations. Does that make sense?
Oh, yes, it does. Okay, the other question is quite similar. Do you share this type of outlook and treatment plan prediction with clients at the beginning when they come to you? As a newer electrologist, I find it challenging to predict both the client side, skin, hair growth, etc., and my side, how fast I can go, and therefore to set realistic expectations without being either vague or more specific than it's possible to be.
So in the beginning, it is difficult. When you haven't got at least 2-3 years of work where you can use your data that on the completed cases already to help you create some sort of a statistic that you can use to give clients an idea of how many hours they will need, it's difficult to do that. I didn't do that in the beginning of my career because I didn't have that data. I only started doing this more recently, maybe in the last 8 to 10 years, when I had collected enough data that I could create statistics, and I was, good enough, confident in myself to say to a client, for your hair type, for how much hair you have, my ranges are between this and this. So recently someone emailed and asked how many hours for a chin. Well, is it a chin or is it a chin? It varies a lot. But I just told her, generally for a wider chin, it can vary between 8 to 22 hours. It depends on how much hair you really have. And these hours are spread over 18 months, let's say. And this is as much as I will say. I dare making more predictions with body areas, especially if I have very similar cases completed, that I can forward the cases, the documented cases, to clients and say, look, I've done someone similar, and this is what this person took me. For example, a guy's back. But, it would depend how your skin tolerates it. It would depend, are you the same height? Are you the same weight? So do I have the same number of square centimeters that I'm going to be treating? And so on. But I would give ranges, and I would give client. I have a portfolio nowadays, and frankly, that's basically the main thing that I talk about in my consultations nowadays. We discuss the treatment plan once I see them, and I show them completed cases. It's so much easier to manage client expectations when you already have the data. But when you don't have the data, you don't need to try to give people, total treatment hours, because you don't have that information. And you shouldn't try to use someone else's hours, because that's their skill. You might be faster than them, you might be slower than them, and it's normal to be slower in the beginning. You're better off being slower but more precise than trying to rush through it. So you can stick to saying it will take 18 to 24 months if we regularly clear your skin at least once every 4 to 6 weeks, and you should be completed pretty much in that amount of time. That's all I used to say when I was starting in the beginning. And if they ask, well, how long is my session going to be? Even today, I say, well, let's have a go. Let's do 1 or 2 sessions and see how many minutes it's going to take me to treat this area. And then we'll start scheduling your treatment according to what we achieve this time. And with time, you will start growing less hair, which means we're going to start shortening the treatment session, or we're going to push the sessions to spread them further apart. So instead of having a treatment every 2 weeks, it will be every 3 weeks, and then every 4 weeks, and every 6 weeks, until there's no more hair to treat. So you don't have to be specific in the beginning, but definitely keep notes from everything, so you can make your own statistic, and then you can start telling clients after 2 or 3 years what you think it will take you. It's also very important to make the right assessment in the beginning, because someone can come to you 6 weeks after laser and they can look like they have just the odd hair here and there, and 6 months later you can see this massive growth coming through of the follicles that were made dormant. So it's important to carry out proper assessment of the hair removal history before you start making guesses how long it might take you. And if it's a laser client, always talk to them about this. Say, you're going to have delayed growth. I can't tell you at all at this point what it will take, because I expect that we're going to see a lot more growth in 6 months' time. This way you've prepared your client for that growth spurt when it comes. And when that growth spurt comes, they're not surprised, and they don't think that you caused this growth. I'm getting probably quite sidetracked now. Did I answer that question?
Yes, surely did. It was very good answer, I think.
All right,
Okay, and one more. Do you
go
ever
on.
do low thermolysis or blend or galvanic for these patients?
So with the first client that you saw, just before her wedding, I think a couple of months before her wedding, I switched to fast blend because she's a picker and she had a long few bits she'd picked and she's distorted because of the scabbing and the wounds. She distorted these follicles so much that even with my best attempts to kill them with thermolysis, I wasn't quite able to. So I switched to fast blend just for those bits to finish them off faster. I do blend maybe less than 5% of my clients. I prefer, and my clients prefer, I do give them the option when I feel that they might benefit from blend, but I'm extremely proficient with flash thermolysis and I don't need blend most of the time. Most of my clients much rather thermolysis, flash thermolysis. It's faster, so it delivers value very quickly to the client. I believe that you can kill hair with all three modalities, and it just depends where your proficiency is. I'm sure that there's people just as quick as me with blend. It's my thing is flash electrolysis. That's what I've mastered. So that's what I go to. And some people are amazing with blend, so they would go to blend most of the time. But yeah, I'm a thermolysis girl.
All right, Jerry. Thank you so much. That's all with the questions. Let me just double check once again. Okay, so maybe you can introduce your lecture that is gonna happen in the Congress in April.
Okay, so when we meet in Warsaw next month, I will be talking about clear or careful. I don't remember the full title, but clear or careful is a little algorithm I created to help people decide whether it's safe for them to clear an area or they should stick to thinning out first before they're able to clear it. And it depends on so many factors, and I think it just makes it easier to go through the checkpoints quickly and decide, yes, I could perhaps try to clear it. We get so much pressure from clients to work faster, clear, and but it's not always safe. So I think having an algorithm to check with and say, yes, this is safe to do, or no, maybe that's not safe to do, it is helpful for people. So yeah, clear or careful. Oh God, sorry, Emma, I can't remember the full name. I could
Yes,
perhaps quickly check.
it was clear or careful.
The strategy. Oh, where was it?
I'll find it. Also, I'll try to
Clear or
find it.
careful. The dilemma in strategic planning of facial electrolysis treatment.
Yes.
So, in Warsaw in April, we will talk about clear or careful, the dilemma in strategic planning of electrolysis facial treatment. Looking forward to it.
Perfect. Thank you, Jerry, so much.